I understand that OCDEL issued a guidance to child care providers on December 20th of 2021 regarding protocols for children returning to child care facilities and child care centers. Could you please tell us what that guidance tells families to do?
Yes, and actually, Trace Campanini, if you could rejoin me at the table.
We were issuing guidance on that date to inform people that we recognized that COVID-19 had been added to the communicable diseases list. As such, we have child care regulations that require children and staff who are suspected of having a communicable disease to return to care with a doctor's note or a certified registered practitioner's note in our child care regulations. So we communicated to the field that we recognized the distinction, or previously we had been understanding that COVID-19 was a reportable disease, but that now we recognize that it should be falling under, that there should be no distinction between reportable and communicable, and in order to return, we should be following our regulations.
So is a note from the pediatrician part of the CDC's guidance for returning to these facilities?
It is not. The CDC's guidance really is a combination of time and symptoms tracking.
Okay, so if not, why is it included in OCDEL's guidance?
The guidance is based, it was a tool that was used to highlight the chapter 55 PA Code 3270, 3280, and 3290 child care regulations. And so we were calling out to providers' attention that we understood that we needed to enforce those regulations and that to return to care, staff and children should have a note.
Well, my understanding is that this has caused a significant issue for families needing to return to work and therefore their children returning to childcare. And this is not a new issue. Serving on the truancy task force in York County, having been involved with the update to truancy laws, we saw a very similar thing happen because there was confusion over what needed to be done. And what we were hearing was that pediatricians' offices were packed with people whose children were not sick simply because they thought they needed a note to go back to school. So there is a backlog at pediatricians' offices right now, and not to mention that this is unnecessary. So given that much of the COVID-19 testing is occurring at home, using at-home rapid tests, not being administered in doctors' offices, what can you do? What is your plan? How are you going to remediate this issue? Because we're seeing a tremendous amount of confusions. Pediatricians' offices need to be a place where people who are sick can get care. You have testified to it here today that there's a lot of pressure on our healthcare providers. There's shortages in terms of staffing, and yet we're pushing people into doctors' offices to get notes that, according to the CDC, they don't need once their child is well in order to go back to child care. So how are you going to fix it?
So as soon as we issued the communication, we recognized the burden that this was going to place on providers, and we also heard from the medical community. We've elevated this to work with the legislature around, because we no longer have regulatory waiver authority on this specific issue.
But I guess my question is, you weren't doing this. It's not on the CDC list. So why are we in this predicament, and why do you need legislative action?
Because now that we recognize that it is a violation of our regulations, we do not want to act inappropriately around not enforcing the regulations that are in our PA code.
I will add to this that as a mom to a 4-year-old that has just had her second week of full in-person instruction since the beginning of the year because of COVID closures, this is something that was an oversight for the first year and a half of the pandemic, where we were not enforcing it because we didn't recognize that it was included in our regulations. A legislative fix is the quickest way to get around having to provide a doctor's note.
Well, I will say this. I have legislation that would create an Office of the Repealer that this administration has said over and over again is not necessary. The fact that you don't actually know what's in your code, I think, points to the fact that it probably is necessary. Again, I have concerns that for a year and a half we don't enforce regulations that are on the book. We suddenly find them, and now we have created a problem for not only our healthcare providers but our child care providers as well. So I would encourage you to rethink this and look to remedy the situation. The last thing we need is our pediatricians' offices overflowing with children who don't actually need to be there. So thank you. Thank you very much, Mr. Chairman.